Welcome to this episode of Learn at Work. This is a webinar sponsored by the journal Work, a journal of prevention, assessment, and rehabilitation. I'm Karen Jacobs, the founding editor of Work, and I am so delighted to be the moderator of this Learn at Work webinar today. Victoria and Claudia will be introducing themselves, and the title of their webinar is Was a Global Pandemic Needed to Adopt the Use of Telehealth in Occupational Therapy? I'm going to turn this over to you now, and welcome so much.
Great. Thank you very much, Karen. I would like to welcome all participants to this session. And today we will be discussing the findings of our paper, Was a Global Pandemic Needed to Adopt the Use of Telehealth in Occupational Therapy, that was published in the January 2021 issue of the Work Journal. So I'm Claudia von Zweck, and I'm part of the operations management team at the World Federation of Occupational Therapists. And I'm based in Ottawa, Canada, and I'm presenting today with Victoria Hohl from the University of Bremen in Bremen, Germany. So we have a true international representation today. Victoria collaborated with WFOT in our international survey assessing the impact of COVID-19 for the occupational therapy profession as part of a secondment that she completed at WFOT. Richard Ledgert, the executive director of WFOT, also served as an author on this paper, but unfortunately Richard's not available to be able to present with us today. We'll hear from Victoria in a few moments. I'm going to start the presentation with a brief introduction to WFOT to understand the rationale for our work on this survey. The outline of the presentation then will follow a similar structure to the article that we published in the Work Journal. After introducing you to the background and objectives for the survey, we'll review the approach we adopted to gain insight into the impact of COVID-19 for our survey respondents. The advantages reported by the survey respondents will be outlined, as well as the barriers and facilitators that were identified with utilizing telehealth during the early months of 2020, a time when most non-essential health services were closed down globally as a result of the pandemic. And finally, we'll review how WFOT has used the information gained from the survey to assist occupational therapists with practice during the pandemic, and what needs to be in place for telehealth to serve as an appropriate mode of interaction between occupational therapists and service users in the future. So I'll start by providing a brief introduction to WFOT for those people who are unfamiliar with our organization. WFOT is the international professional organization representing occupational therapists and provides the global voice for occupational therapy. WFOT exists to represent the occupational therapy profession in its role of improving world health and well-being. And it's a global network of 105 member organizations that represent approximately 580,000 occupational therapists worldwide. As part of our mandate, WFOT sets global standards for occupational therapy education, promotes research and use of evidence in practice, and creates awareness of the profession in our role of enabling engaged and meaningful lives. With the onset of the COVID-19 pandemic in early 2020, WFOT undertook a global needs assessment survey to understand how the Federation could best support occupational therapy during this unprecedented time, a time when many people became ill with COVID-19 and strict restrictions were implemented in most parts of the world to control the spread of the virus. The purpose of the survey was to obtain input regarding how the COVID-19 pandemic affected the quality and delivery of services in occupational therapy education, research, and practice, as well as understand the needs of the occupational therapy community for resources and support. When we analyzed the results of the survey, we obtained many interesting findings related to the use of the telehealth. We therefore decided to publish a separate paper related to telehealth use in occupational therapy that we're presenting today. I'm now going to hand over to Victoria, who will review the methodology and the findings. So, welcome, Victoria.
Thank you, Claudia, for the introduction. So yeah, hi everyone. My name is Victoria Hoel. I am a Marie Curie Early Stage Researcher Fellow. So I'm a Norwegian, but nowadays I work at the Institute for Public Health and Nursing Science at the University of Bremen in Germany. And disclaimer here, my background is not in occupational therapy. But as Claudia mentioned, through my work, I had the privilege of collaborating with her and Richard Ledyard of the WFOT, analyzing the global survey, assessing the impact of COVID on occupational therapy, the occupational therapy community worldwide. And this is the reason why I'm here today. So this global needs assessment survey was circulated in the occupational therapy community between April and July of 2020 and was available in 5 different languages. The survey included 30 items, which were primarily multiple choice questions. But in addition, participants had the opportunity to provide comments throughout the survey. And the final part asked respondents to give their recommendations, given their experiences through the COVID-19 pandemic, for future work within occupational therapy in education, research, and practice. Next slide, please. Thank you. So descriptive statistics and bivariate analysis were conducted to assess the quantitative survey data with an ordinal logistic regression model to understand the influence of different respondents' characteristics on outcomes of work during COVID. And finally, free text responses were translated to English with the help of native speakers before being subjected to an inductive thematic statement analysis. Next slide, please. A total of 2,750 individual responses were received from 100 countries, where 57% of the respondents were living in high-income countries. The majority worked as practitioners in clinical roles or educators or researchers. Respondents also mostly worked in facilities, such as hospitals, rehabilitation centers, or nursing homes. Next slide, please. And the quality evaluation strategy tool, known as QUEST, is a tool developed by the WFOT to provide a systematic approach to the evaluation of quality in occupational therapy. By following this framework, we were able to identify the most prominent issues and requirements for occupational therapy during this pandemic. As Claudia mentioned, these issues and trends are reported in another publication, but I'll quickly run through them before we return to the focus of telehealth. First of all, the recognition of occupational therapists' increasing role in our public health systems was widely voiced. Second of all, the need to ensure equal access to equipment, standardized procedure, technology, and rights for occupational therapists in their work. Barriers and facilitators in using telehealth, which is what I will come back to later. But we also identified different requirements to avoid disruption in education and training of occupational therapists, especially with a focus on digitalization. Consensus, exchange, and unity in evidence-based practice guidelines and other professional resources was also needed. And finally, advocacy and raised awareness around occupational injustice and the important role occupational therapists play in ensuring the population health was a trend that was recurring when we analyzed the free text responses. Next slide, please. Again, as mentioned, while we analyzed the results, the importance of telehealth during this pandemic really became clear. And that's why we decided to write a companion paper that could sufficiently provide the attention that the role of telehealth deserves. So with the need to limit in-person contact after the COVID outbreak, many occupational therapists turned to the use of telehealth to provide their services. So research indicates that the successful introduction of telehealth in healthcare systems requires an approximate 23-month timeframe for full implementation. But given the need for rapid transformation in service delivery, prolonged planning was not possible for the implementation of telehealth during the first COVID wave. Instead, providers were required to implement telehealth within just a few weeks to minimize service disruptions. Next slide, please. So of the 2,750 survey respondents, 49% of them stated that they used telehealth services in their work during COVID, usually for consultations, interventions, and monitoring. But while supervision and evaluation were also areas of frequent use, only 32% of telehealth users reported to have evaluated the effectiveness of using this mode of service provision during the pandemic. Next slide, please. So a profile of telehealth users emerged from our bivariate analysis. A chi-squared test for independence indicated a statistically significant association between the usage of telehealth with respondents working in a clinical role, working in a facility setting, receiving public or private funding, residing in an upper middle or high income country, and finally, for those who experienced many or complete COVID restrictions. And findings from our ordinal logistic regression model indicated that using telehealth had a significant positive correlation with scores of safety, perceived reasonableness of employer expectations, and the impact of the pandemic on work morale. So those who used telehealth in their work during COVID were 1.16 times more likely to perceive their employer's expectations to always be reasonable when compared to non-users. And similarly, individuals who had the opportunity to provide remote care were 1.17 times more likely to report a positive impact of COVID on their work morale. And finally, telehealth users were 1.62 times more likely to score a higher sense of safety while working during the pandemic. And our thematic statement analysis offered some explanations to these positive findings, but also uncovered some challenges in adopting remote practices among the respondents. Next slide, please, Claudia. So respondents, they indicated that with using telehealth, services could be provided with a reduced fear of contracting or spreading the virus, increasing safety for both themselves and their service users. Telehealth also provided an opportunity to continue providing occupational therapy when restrictions imposed limited in-person contact. Telehealth was often the only option to remain connected with service users, although in a different and sometimes reduced capacity. And despite the need to transition quickly to this mode of service provision, many commented that when sufficient support for telehealth was provided, they were able to attain favorable outcomes. Some indicated that they, as well as their service users, had unexpected gains from using this changed mode of service provision. And several stated that the use of telehealth should continue after the pandemic, as telehealth was found to be a valuable supplement to the portfolio of services. Next slide, please. Of course, despite the reported advantages of telehealth, respondents faced many challenges in using technology for service delivery during COVID, where the four largest barriers identified were, first of all, limited access to technology, funding issues, slow systems change, and finally, limitations to the available technology. And I'll now elaborate a bit on these four themes. Next slide, please. So first of all, access to required technology was frequently reported as a barrier to the use of telehealth for the delivery of occupational therapy. Such difficulties impacted both providers and service users, most often involving internet connection issues or availability of required hardware, such as computers and webcams. And for many providers, these issues were further hindered by limited knowledge of appropriate online platforms and also procedures to organize telehealth. Service users from lower socioeconomic communities were reported to be more disadvantaged for accessing technology, making them more vulnerable to isolation and then receiving fewer services. The second barrier, related to funding issues, came from the fact that the transition to remote service provision was too abrupt for many to ensure financial coverage of services provided remotely. For example, proper telehealth billing procedures were lacking, which resulted in reimbursement losses for many respondents. And also the increased workload resulting from transitioning to remote service provision was also often not met by increased resources or compensation, which was incredibly frustrating for many respondents. The third barrier evolved around the sole systems change. So many commented that systems were simply too slow to adopt telehealth at a time when rapid shifts in practice were necessary because of COVID restrictions. The pace of change simply did not meet the needs of service providers or their users. And in addition to limited access to technology, we also identified important barriers in the technologies themselves. Remote services was noted to have shortcomings for some populations due to the very nature of occupational therapy, where much of the service provision is dependent on direct and close contact between the provider and service users. In addition, service users were sometimes overwhelmed with receiving services remotely or supporting family members that did, which reduced their capacity to effectively engage through telehealth. Some service users struggled with learning to use technologies required for telehealth services, or were even skeptical about this mode of service provision. Next slide, please, Claudia. So in the final section of our survey, respondents were asked to provide recommendations given the experience they now have for future service provision via telehealth. The three most prominent themes that emerged were recommendations related to 1, telehealth strategies and guidelines, 2, policy and public promotion, and 3, education and training in telehealth. And again, I'll elaborate. Next slide, please. So the need for strategies and guidelines stems from the rapid transition to telehealth, which placed respondents in unfamiliar territory with a steep learning curve for using new technology. There was also a concern that telehealth use may be generalized to all areas of practice without due consideration of the needs of vulnerable individuals. So therefore, guidelines to specify the scope of remote care was recommended, mostly to recognize potential limitations of telehealth and identify when in-person care is vital. Managers were also seen to play an important role to assist with the integration of telehealth into the workplace, as well as to implement guidelines and ensure availability of required technology and online platforms. However, guidelines and managerial strategies alone are not sufficient to ensure the appropriate integration of telehealth in occupational therapy. So respondents voiced the need for defined policy and regulations relating to telehealth to address issues such as access to technology and recognition and the reimbursement of services. As such, recognition requires public acceptance and trust. Respondents indicated that telehealth needs promotion as a valid and appropriate form of service that can meet the needs of users. Therefore, dedicated research and broad dissemination of evidence regarding the value of telehealth was considered a key component in promoting the use of this mode in occupational therapy. And finally, the third facilitator of training and education. Training was by far the most frequent recommendation when implementing telehealth, as many struggled in adapting to the use of technology for service delivery. Such training was recommended for both providers and service users to equip them with necessary knowledge and skills for remote care to be effective and safe. Students and educators also encouraged the inclusion of telehealth practices in the curriculum for entry-level occupational therapy education programs. A lowered fear of technology through exposure to such strategies as a student already may well facilitate later adoption of telehealth during practice. Next slide, please. So these results suggest that telehealth is a crucial supplement to in-person occupational therapy, even in a future post-pandemic era. Clear strategies and guidelines must be available in a healthcare system that is responsive enough to meet the society's need in a timely manner. This includes legislation and sufficient funding to avoid service disruptions. And policy is also needed at the organizational level, as recommendations stress the importance of training in the use of technology, implying a needed support from the leadership level. As the adoption of telehealth is dependent upon end-user acceptance, public promotions should be emphasized to further these requirements onto the political agenda. And therefore, we know that robust research and evidence dissemination is needed to create awareness of the benefits of telehealth. And again, interestingly, as only 1/3 of respondents using telehealth implemented outcome measures to evaluate their remote service format, this finding likely reflects the volume of change and the speed of action required to avoid service disruption. I'm sorry. So yeah, I'm sorry. So there is a need to evaluate telehealth services, is my point here. Data collection regarding the effectiveness will be vital to ensure the appropriate adoption of technology in the provision of occupational therapy. Next slide, please, Claudia. So, despite the reported challenges and turmoil associated with rapid change in practice, the success of the use of technology for service delivery during COVID's first wave led to recommendations for the long-term adoption of telehealth as an adjunct to traditional in-person contact. It is important to note, though, that the reported findings are based on a survey circulated in the spring of last year, when the needs to transition to telehealth services and community restrictions were still very new. Viewing these results in the current context, it is important to acknowledge that much has been learned since the COVID-19 was declared a global pandemic. So, resources from many occupational therapy professional associations are now available, including online telehealth guidelines, provider reports, billing procedures, information on funding schemes, and guidance on e-learning. Nevertheless, spearheaded efforts are required to ensure that the standard of care provided using telehealth strategies remains equivalent to in-person contact and complies with all jurisdictional, institutional, professional regulations and policies governing in practice. So, with all that being said, I would like to give the word back to Claudia, who will bring you through the WFOT actions in the light of the COVID-19 pandemic.
Great. Oops. Thanks so much, Victoria. So I'll just discuss a little bit some of the actions that WFOT has taken in response to the findings. The actions were really to address 4 priorities that we had identified as a result of the findings. The first being advocacy regarding occupational injustice that increased the vulnerability of people to the effects of the pandemic. The second is advocacy to promote full participation and inclusion of people within the confines of the restrictions imposed by the pandemic. Thirdly, to provide information and supports for occupational therapy during and following the pandemic. And lastly, to provide standards to promote quality provision of occupational therapy practice, research, and education. So examples of the work of WFOT include public statements to promote actions related to the consequences of the pandemic for occupational engagement and participation, and raise awareness of the associated health concerns. As many rehabilitation services were restricted during the pandemic, WFOT also published public statements advocating for improved access to rehabilitation, particularly for people who were affected by COVID-19. WFOT statements address standards for occupational therapy education and the need for innovation in the provision of learning opportunities as a result of the pandemic restrictions. And WFOT offers a number of position statements and other publications that can guide occupational therapy practice during emergency situations such as the pandemic. And the resources are available free from the WFOT website. In addition to the position statements and the publications, WFOT offers free online training on topics relevant to occupational therapy practice during the pandemic, such as disaster management, quality service delivery, and human displacement. To facilitate the sharing of information globally, WFOT offered interactive online forums for occupational therapists and educators on topics such as practice initiatives related to the pandemic and student practice placements and support. WFOT also developed a centralized repository of COVID-19 resources that were relevant to occupational therapy, including information from WFOT, new research literature related to COVID-19 as it became available, and member and partner organization resources, such as new learning opportunities and updates from the World Health Organization. WFOT and our advocacy also submitted statements related to our positions to the World Health Organization, both centrally at the World Health Assembly, as well as at regional WHO meetings. So more information about the results of our needs assessment for COVID-19 is available from the publications that are pictured here on the slides, particularly the first that was published in January 2021 in the Work Journal. And if you have any further questions, or you would like to have more information about some of the publications and resources that we've talked about today, please feel free to contact WFOT through any of these communication channels. So on behalf of Victoria, Richard, and I'd really like to thank you for participating in today's session. And I think we perhaps may have some time to answer some questions if anybody has questions for us. So, Karen, I turn it over to you.
Thank you. Yes, thank you. That was such an interesting presentation. And what's striking to me, having heard Victoria present previously, the enthusiasm and the understanding of occupational therapy is wonderful. So thank you so much. And just letting our attendees to feel free to type in the chat box or in the question box, and I'll read that. So again, thoroughly enjoyed listening to this very important study, because prior to doing this survey, we knew a little bit, but not as much as we understand now about telehealth globally. You mentioned, you know, a little bit about the impact of, you know, what you found in the study, and particularly during, you know, COVID-19, the pandemic, which of course, you know, we're all still experiencing. But have you thought about the impact of the study in the future and what it might do to help occupational therapy practitioners and future occupational therapy practitioners be able to practice using telehealth technology? Do you have any thoughts on that? And Claudia, I'll direct it to you.
Sure, sure. So certainly I think that we have seen with the onset of the pandemic, the value of telehealth, and it was always something I think that people were aware that it was a modality that was available for to practitioners or educators to as an adjunct, I guess, in terms of how service provision was provided. But it's now, I think, people really see the how it can be used, and I think over the course of the past year, people have become much more sophisticated in the use. I think of initial days on Zoom and on Teams, and how we all struggled in terms of understanding what platforms were available and how to engage with them. I think now people are really learning how to effectively use these technologies, and I think our learning will continue to evolve over time. I think what this study had shown was that it's not just a useful adjunct during the pandemic, but it had many advantages for service delivery that I think will carry over in the future. That people found, for example, that for some types of intervention, it was much easier for client therapist interaction to be able to meet, say, by telehealth, and that there potentially could be more effective or be more cost effective in terms of services. I think it is important that we continue to do research in this area, however, to really determine where the most effective use of, where we can most effectively use telehealth. But certainly, I guess, anecdotally, and I think that we can really see the increased use. And certainly, it's also evidenced by the fact that we're now seeing all these new resources being developed by our member organizations with respect to telehealth, that obviously they're recognizing that there is a need, and they're developing resources and guidance along that line. So I hope
Yes.
I've answered the question. Yeah.
No, thank you. And I agree, and that telehealth is here to stay.
Yes.
And it's really important. I'm a big advocate. In fact, I was involved in telehealth for many, many years. I worked with Nancy Baker to create a online ergonomic assessment that we could use telehealth technology. And boy, did it evolve over time what technology we could use. And I think that if there's a positive from the pandemic, it pushed occupational therapy as a profession into better understanding telehealth. And the pros and cons of using it, particularly after the pandemic. But I think that your study really helps underscore what we need in the future, and maybe knowledge and skills that we need to provide in our educational programs to prepare our future occupational therapy practitioners to see how they can use telehealth in the future.
That was certainly a comment that we received from respondents, that that people felt that if it were something that were included in their education program, that it would be something, a modality that would be much more comfortable for them, for their practice in the future. So yeah, and well, certainly I think that over the past year, students were forced to often go online for a significant amount of their education. So they have become much more sophisticated in their use of online technologies. But I do think I think there will be long-lasting effects, that people will be more comfortable with use of telehealth in their practice in the future.
Yes, I absolutely agree. And I'll tell you a little funny story. So in my role at Boston University as Associate Dean of Digital Learning and Innovation, I converted my small, very modest research lab into a telehealth center for our college. And this was before COVID, months and months before COVID. And then, you know, some of the different professions used it. I think it was our speech language department used it, and then COVID came. And I look back on reflecting on it, that we didn't need a little center anymore. We can use our offices or our homes to deliver telehealth, so that it pushed us into thinking differently and thinking creatively and being innovative. And I'm hoping that we'll see this happen. I can share that in the courses that I teach with entry-level doctorate in occupational therapy students, again at Boston University, One of the courses, I have the students working with local students with intellectual disabilities using telehealth technology so that they become more comfortable.
Right. Yeah. Yeah. Oh, that's terrific because and understanding how to best utilize it, where it's appropriate, and how to most effectively use what's available to them. Yeah. I think that's great.
And again, I want to just underscore the importance of this study. And I want to thank both of you. Victoria, I hope someday I'll get to meet you in person. Claudia, we've had the pleasure many times. I look forward to seeing you at the World Federation of Occupational Therapists Congress in 2022 in Paris.
Yes, yeah, that would be great. The irony of working on this telehealth paper together with Victoria is actually we have never met either face to face. We have done all of this by telehealth as well. So there you go. We practice what we preach. So yes.
Oh, that's, I have to say that it's wonderful. It's
great.
And Victoria, it has been a pleasure to have you participate. I know I won't do this to you, but I could ask you for the definition of occupational therapy, and I know that you know what it is. And thank you for promoting our profession.
No, it's my pleasure. That I'm very honored to be included in this work, because I think telehealth is important not only within occupational therapy, but also within, we can see how many other professions actually could benefit from using telehealth within their both clinical practice, but also within education. So I'm very happy to be a part of the promotion of telehealth adoption, because it doesn't only need the bottom-up approach where people recognize the benefits that they can sow from telehealth, but we also need the top-down recognition if we are to promote the adoption of this service model. So although I'm not an occupational therapist, I'm very happy that I could be a part of the work of promoting telehealth.
I'm really appreciative, and you said something that triggered a thought that I would like to conclude on, and a challenge to people listening to this. We need more research in telehealth. We need more research to support the comparative effectiveness of it. And so your study challenges us to really advance the evidence to support the use of telehealth in occupational therapy and in other professions as well. So both of you, thank you so very much. And I want to thank our listeners for being here with this webinar from Learn at Work by the journal Work. Thank you both so very much.
Thank you.
Thank you.